Okay. Okay, let's see. So I have some introductions written out for you guys, but I'm more than happy if you guys want to take over and introduce yourselves instead, whichever you prefer.
Okay, you want to go first, Mitch?
Sure. I guess we're going to do our own. I was curious what other people say.
Okay, well, I'll start actually. We're just gonna wait a couple more minutes and wait for a couple more people to join since it technically doesn't start till 12:30.
So just to review the flow, so we'll introduce ourselves and then you'll go to the questions.
Yeah. I'll introduce myself and the goal of the discussion, and then I'll start with you, Dr. Geffner, for introductions, and then Professor Shamir, you can follow. And then I'll lead into the questions.
Okay, but are we introducing ourselves, or are you? I didn't quite follow that flow there.
Whichever you prefer. I'm more than happy to do it. Okay, I'll do it.
You can earn your keep.
Okay, awesome. Sounds good. Just a couple more minutes here. Professor Shamir, what time is it for you right now?
It's 10:30 p.m.
Oh, wow. Well, thank you for staying up for us.
Really? I hope I don't put you to sleep.
It goes vice versa.
Well, for me, I just had lunch, so I guess I could have a siesta.
Yeah. Okay, just a couple more minutes. Dr. Geffner, you're in Los Angeles, right?
That is correct.
Awesome. Okay, so as everybody's joining, there is a chat on the right-hand side of your screen. Feel free to introduce yourselves, to tell us where you're joining from. It'll be interesting to see where our network brought us. And looks like there's a good bit more people joining. Catch everybody right in the middle of lunchtime.
Only if they're on the West Coast.
Yeah, that's true. That's true. Or some companies have summer Fridays, so maybe people getting off work today, getting off early. Okay, so it's 12:30, so we're gonna get started. My name's Mackenzie. I am the in-house nutritionist and education specialist at Nutritional Growth Solutions, more specifically Healthy Height, which is our American brand. And today we're going to be discussing the impact of nutrition in childhood development. And we have two great panelists with us. We have one of our co-founders, Professor Shamir. And Professor Shamir is the chairman of the Institute of Gastroenterology, Nutrition, Liver, and Diseases at Schneider's Children's Medical Center of Israel, which is where our product was founded, which is really exciting. So thank you, Professor Shamir, for joining us. And we also have Dr. Geffner, who is a part of our Healthy Height Scientific Advisory Board. Dr. Geffner's longstanding science research interest is in the general area of hormone resistance, while on the clinical side, he is involved in the studies of new formulations, delivery systems, and indications for growth-promoting therapies. So really exciting. I'm excited to tap into both of your wealths of knowledge and share with our community. So this discussion will consist of 15 minutes of questions that I'll be asking Dr. Geffner and Professor Shamir, and then we will have 15 minutes for community questions. So please use the chat box to the right to ask any questions. We did get a couple on LinkedIn that I'll be addressing. And then at the end of the discussion, we will have a survey sent and a recording of the discussion to everybody who registered. So for those that couldn't make it, we'll still get the information. Okay, so we're going to dig in. We understand that genetics plays a strong role in growth, but we also know nutrition greatly influences growth and development. So this first question for Dr. Geffner, throughout your research, what are some of the ways you've seen nutrition impact growth in children?
Thank you, Mackenzie. Well, the most obvious situation relates to overnutrition. Everybody knows has become an explosive epidemic in children and adults in Western countries, and now is even being seen in resource-poor countries. With COVID and the self-quarantine attached to that, this has gotten worse in adults and children. Perhaps for the obvious reasons of being at home with greater food access and not going out and having less exercise. For the record, though, children that are overweight or obese, by virtue of eating too much of the wrong things, tend to actually have nutritional deficiencies. For example, related to vitamins and minerals, specifically vitamin D, but also other vitamins and iron and zinc. Children that carry too much weight will often actually be taller than expected in early childhood, reaching their adult heights sooner than if they had normal weight. They also have a tendency, particularly in girls, toward early puberty, less so in boys. Research-wise, I've been involved in studies of nutrition, appetite, weight, adiposity in several different conditions, including type 2 diabetes in youth, which is exploding as well. HIV infection, and even in those who were exposed to maternal antiretrovirals because their moms had HIV, but they themselves didn't get it. In conditions such as congenital adrenal hyperplasia, optic nerve hypoplasia, and a number of others. Now, at the other end of the spectrum, there's undernutrition, which I see in my practice also frequently. This includes children with overt and subtle classical eating disorders such as anorexia nervosa, or those with food insecurity, or lastly, in a large swath of children who have either ADD or ADHD, or they're treated with stimulant therapy, which suppresses their appetite and on occasion also slows down their height velocity. I've done research in related areas involving the HIV population again, and also specifically in children with attention deficit disorders.
Okay, great. Thank you. Professor Shamir, do you have anything to add to that?
Yes, I would like to add, I obviously share the same views as Dr. Geffner. My research also involved the relationship between nutrition and linear growth. And one of the things that we learned through our clinical studies and also our basic science studies is that macronutrients, especially proteins, are very important for linear growth. And it's not only the quantity, but also the quality, because different protein sources provide different results in height gain. And obviously, micronutrients play a role as well. So it's in addition to our genetic background, which is most important, nutrition does play a role in our linear growth.
Great. Totally agree. So this question again is initially for Dr. Geffner. In the US, we talk a lot about childhood obesity, which you briefly touched on. What are some other nutritional concerns that you feel the community isn't talking about enough? And where do you feel that there are gaps in the current research?
Sure. Well, again, I think there's an under representation of the nutritional deficiencies, as I mentioned a moment ago, that occur in those with obesity. Just too much concentration on the size of the person, but not what's going on nutritionally inside their body. And if someone is vitamin D deficient, for example, which occurs frequently in the obese population, leading to potentially weak bones. With a large body and a small fall, it'd be very easy to break a large bone. And so I think this clearly needs attention. Vitamin D may also play a role in immune function, as may zinc. And if these are deficient in obese children or anybody for that matter, this could add additional medical consequences. Another nutritional area I think that really the community is just starting to talk about has to do with that food insecurity, which is a growing problem and refers specifically to a lack of consistent access to enough food for an active, healthy lifestyle. This results from, in general, low financial resources, and the numbers on this have gone up dramatically in the United States, specifically with the addition of COVID. And it's estimated in 2020 that there were 45 million people and 15 million children who had food insecurity. And this is a huge societal problem and one that I think needs a tremendous amount of attention.
Okay. So what are, besides taking the blood and seeing the vitamin D deficiency, what are some signs of vitamin D deficiency that parents can pay attention to help their children?
Well, outside, I mean, looking at a body, it's very hard to see that. It's at least until it's very late stages. Unfortunately, and that's part of the problem is that, if you don't see it or it doesn't hurt, it's not important.
Right.
And so, I'm coming from a more of a preventative standpoint in this area. And it's just a matter of bringing this to giving us greater attention, I would say.
Okay, great. Thank you. Professor Shamir, do you have any international perspective on that? In Israel, you might not have as big of an issue as obesity, but what are some nutritional concerns for children in Israel?
Well, it's not only Israel or Europe, it's also the US. There is a study from 2017, I think the first author is Bird in Nutrients, that have shown that every third American suffers from at least one micronutrient deficiency or anemia. I think that globally, we do see that even we like to relate those deficiencies to malnutrition in the third world. But inadequate nutrition is a universal problem. And also in affluent societies and the United States, Israel, Europe, everywhere, inadequate diet does result in micronutrient deficiencies. So I think that it's not only malnutrition or undernutrition or obesity, but also inadequate dietary habits that causes people to have an imbalanced diet.
Great. Thank you. So families have different approaches to nutrition and different outlooks on what it means to serve a nutritious meal. Professor Shamir, do you have any advice on how to make sure basic nutrition needs for optimal growth are met?
Well, this is a very good question. I think the first important thing is to make sure that our children are having a balanced diet that contains all food groups. And I think one of the problems that we see is that, children are skipping breakfast. Children are not having dinners. and having meals and having all food groups in our meals, having, and I'm not getting into specific dietary patterns, like if you're a vegetarian or vegan, but regularly you should have meat, and you should have milk, and you should have fruits, and you should have vegetables, and you should have grains. And if you make sure that your diet is balanced, then and contains all food groups, then this way you will ensure a proper diet of your children. Obviously, there are those who are picky eaters, those children who are very selective eaters, and there you need really personal guidance in order to find the appropriate diet, the appropriate nutrition advice, and in certain cases you may need also to supplement. But basically, keeping normal dietary habits and having all food groups, that's the general advice I would have.
Okay, great. Dr. Geffner, do you have anything to add to that?
Well, I 100% agree, and I would just add to that all of those recommendations, which are solid, have to be viewed, though, in the context of a family's socioeconomic background, their cultural preferences, what they like to eat, and just simply their belief systems, because these factors enter into what goes into what's on the table and what goes into a child's mouth, and we have to be very cognizant of these different things in terms of how we take those general recommendations and make them more specific to an individual child and family.
Right. Thank you. So for those of you who are unaware, Healthy Heights was developed to help children with issues relating to growth, and for those that do not have access to human growth hormone therapy or don't have it as an option. The team at Schneider's Children's Medical Center in Israel took their wealth of practical and clinical information and used it to develop a formula to help children with short stature grow. Professor Shamir, can you talk to us about how the study was conducted and what the findings were in the clinical study?
Sure. And actually this relates also the things that we discussed earlier. What we wanted to do is to take all our knowledge about the macro and micronutrients that are important for linear growth, put them into a formula, and provide it to children. And what we did was, and this was published, as you can see on the slide, in the Journal of Pediatrics already in 2014, we wanted to examine the effect of this nutrition supplement on growth in short and lean prepubertal children. We really did it like a drug study. It was a prospective, randomized, double-blind, placebo-controlled study. Can you show the next slide?
Yes.
And what we did was that we took children who were 3 to 9 years of age, and we gave half of the children the nutrition supplement, and half of the children got the placebo. It had the same texture and the taste as the formula, so neither the patients or the researchers knew what they are getting, and they got this for 6 months. And since we felt that we want to provide the formula to everyone after 6 months, all the children got the formula for another 6 months. Next slide. What you can see, and actually it's like drugs. If you don't get the drug, it doesn't have an effect. And the same, if you don't take the nutrition supplement, you will not have an effect. But those who were good consumers, and we defined that before the study as at least 50% of the daily suggested amount. So these were good consumers. And you can see on the bar, which is the second bar from the left, I don't know, well, you don't see my arrow, but those who will consume the formula, the good consumers, had a significant effect on their height. There was a small effect also in the placebo group, but this was statistically significantly different. Next slide. Another thing that we looked was as a dose response. We did a dose response analysis to see whether the more amount you had, the more effect you had. And as you can see here, there was a very significant correlation with height and a very significant correlation with weight. However, there was no correlation with BMI, suggesting that we did increase weight and height, but proportionally without an adipogenic effect. Next slide. And here you can see the red on the left side of the slide. You can see the growth of the children who got the formula. The placebo is in blue for the 6 months. And then after another 6 months, all of them got the formula. You can see that the effect continued, a little bit attenuated in the formula, but in the placebo, the rate was similar to the formula in the first 6 months. Overall, there was a 0.19 standard deviation effect of the formula over 1 year of supplementation. And that's the effect of the formula that is now distributed in the US as Healthy Heights.
Great, thank you. Thank you for explaining that. Okay, so at this time, we are finished with the discussion portion. So we're opening it up to the community for questions. Let's see. So please use the chat to ask any questions that you guys may have. We did get a question from LinkedIn that I'm super excited to ask because I think a lot of people have this question. So regarding plant-based diets and those that have dietary restrictions regarding vegetarianism, veganism, what is the impact on a plant-based diet and plant-based proteins on childhood development if there is an impact, and is it better? We can start with Dr. Geffner.
Sure, but I don't have a lot of personal experience, but I definitely have some. And my understanding is if the diet is balanced, via what is actually in it, that there shouldn't be a significant effect or an adverse effect on childhood height or pubertal timing. I would defer to Dr. Shamir if he has other information, but I'm not aware that there's any effect.
Okay.
Yeah, I totally agree. We in our clinic see many children who practice more. Vegan is more difficult to handle than vegetarian, but any diet can maintain adequate nutrition supply if it has to be monitored by either if the parent is very educated in nutrition or you need a nutritionist, because you really need to evaluate the diet. And this is the main thing. And I see also in the chat, someone asked whether we suggest supplementation to our children, whether we use supplements. And what I'm saying is, and these are two different questions, because when we spoke about our formula, we spoke about increasing height in short children. But if we're talking about a balanced diet and to use supplements for a diet, then only if the diet is not balanced, and you really need to evaluate the nutritional intake and to see whether there are deficiencies. And if there are deficiencies, then yes, of course, we do use nutritional supplements. However, it's not easy, and you need good advice from a nutritionist. You can build an adequate diet for vegetarians and for vegans as well.
Awesome, thank you. So in a similar vein to that, with Healthy Height, we are a dairy product, and that's because our researchers found that dairy was the most effective in promoting growth. So for those children that cannot consume dairy for dietary restriction reasons or allergies, what do you recommend for those children to avoid impeding growth? Dr. Shamir.
Well, again, the best effect is achieved with dairy products, the whey protein has the best effect on linear growth. However, it is like breastfeeding. It's not, either you're breastfeeding or not, because any breastfeeding is better than not breastfeeding. And again, there are nutrition supplements that are plant-based, and although they're a little bit inferior, because if you can have dairy products, it's better to use them. But if you're not able to use them for any medical reason or religious reason or cultural reason, then plant-based supplements are also adequate for promoting growth.
Okay, great. Thank you. Okay, looks like we have a couple questions in the chat box. Let's see. Okay, so Christian asks, how would you suggest talking to parents to help uncover where there may be gaps in their children's nutrition?
Well, during the interview, it's very important to go over the dietary intake of the child, to see the dietary patterns, how many meals, what is in a typical meal. Obviously, if you want to go in depth, this is not enough. Any nutritionist will tell you that a food frequency questionnaire would be better to assess dietary patterns than just having a 24-hour recall, and 72 hours recall is better than 24, and a 1 week recall, including weekend, is better than 3 days recall. So obviously, you can go deeper and deeper. But in our interview as pediatricians, one way to quickly pick up children who have problems is when you see that there are meals that are being skipped, when there is a picky eater or selective eater, and when you go over what they eat, you find out that there are food groups that are avoided.
Great. Dr. Geffner, do you have anything to add to that?
Sure. I mean, we do 3-day dietary recall and discourage patients from telling us coming back in 3 days from when we see them and telling us what they ate, because then they change what they ate, and that's I mean, not always, but and perhaps the use of apps on the phone and the computer can help with this whole process.
Right. We have an additional question from Michelle. It's asking about children who are being treated for ADHD with medications and suffer from a suppressed appetite. What do you guys suggest to combat this? We can start with Dr. Geffner.
Yeah, this is a problem I see every day. I mean, it reflects the wide-scale use of stimulant medication for children with ADHD or ADD. I mean, it's just omnipresent. Now, most children who take this class of drugs do not have any significant effects on their weight or height, or else I would be doing nothing but that. Or maybe they just go to my colleagues. I don't know. But the ones that come tend to be a little bit more the severe ones, or the kids of parents who are a little more just intense. So the way we try to handle this, first of all, is we try to have the child take the lowest dose possible of these medications, and that involves sometimes communicating with the doctor that prescribed them, because that's not going to be us. We also encourage drug vacation, meaning that if possible, that the medication not be taken on weekends or on summer vacation, etc., just to minimize the overall exposure. Now, there are some kids you can get away with that, and there are others who need it every single day. And their general eating pattern is they will have breakfast, because the medicine's usually taken in the morning and is long worn off by then. Not big on morning snack or lunch or afternoon snack. And if you're lucky, they will eat a very large dinner, hopefully well balanced, as the medication wears off. There are some patients, however, who take an afternoon dose, a smaller dose, and the morning dose tends to be the medications are often a long-acting variety. We try to work around all these obstacles. And sometimes you can, and sometimes you can't. There's also changing the regimen to something that doesn't involve a stimulant, but that may not work as well. So it gets very complicated. So I have patients who have an agenda when they walk in the door because they've kind of been through all of this and done all of that. And they say, I'm not leaving till you give me a prescription for growth hormone. I mean, this is reality, at least in Beverly Hills, let's say. And so I won't say that I never do that, but not usually on the first visit. But I think an alternative approach is necessary. And Dr. Shamir, I would say you need to do a research study in that particular population, because I can give you all your patients you need. You don't even need to go to another investigator. Well, I mean, that's not the right way to do it, but you understand what I'm trying to say. I think, this is a population that really needs a simpler, logical, safe, expensive, relatively speaking, treatment, and growth hormone. Really, these children are not growth hormone deficient. I mean, it doesn't make sense. So I encourage you to do that.
Yeah. Well, we don't need encouragement because we are planning on doing it. We have a research protocol. We are going to study the healthy heights in ADHD patients. There is a huge need for that. I know I have patients with ADHD that do take the supplement before they take growth hormone, but it needs to be studied in a proper and scientific way to show that it's really helpful. I totally agree.
Awesome. Well, thank you guys so much for your time and for answering our questions. And thank you everybody who joined our discussion. When we close out, you will be sent the recording of this, a survey, and also a link to, oh yes, Professor Shamir.
There was another question just before you close. Is there a nutritional benefit in supplemental diets in preteen teen populations? And this goes well with the question of Dr. Geffner about the ADHD study, because we just, last week, we published our results also in teen population with a different formula, because, teenagers need different amounts of macro and micronutrients. And we published the study of teenager of boys, because we are doing also a study in girls that is not completed, because at this age, the requirements are gender specific. And it does work also in adolescent boys, just published last week in Acta Pediatrica. Sorry to burst into your summary.
Oh, no worries. No, we're really excited to publish or to share that study with our Healthy Height community, because it's going to be great. And we definitely understand that there's a need for preteen and those past 9 years old for growth concerns. So that's going to be really exciting. So like I was going to say is that we're about to send out the recording of this, a short survey, and also a link for medical professionals to request samples of Healthy Height for those that do have growth concerns for their patients and need supplementation for it. So thank you everybody for joining us. This was great. Special thanks to Dr. Geffner and Professor Shamir. You guys are awesome, and this was really helpful.
Thank you for having us.
Absolutely. Appreciate it.
No problem.
All right.
Okay.
Good afternoon to you and good night to me.
Yes, good night. Thank you for staying up for us.
Have a nice sleep.
Bye.
Talk soon.
Bye.
All right.
Bye.